Okay, had another call, didn't want to be on the air, but a person had a knee replacement several years ago. The knee still hurts. Doctor says there's nothing wrong with the implant, that I need to lose some weight. I've gained a little since surgery. Can the ablation help me?
Well, that's a good question, and actually that's probably the group of people who I've found do best with the benefit of the radiofrequency ablation. Here is a model of a knee joint, and this is a plastic model of a knee joint without the kneecap or the patella in the front. But it's supposed to be a model of a native knee. Of course, when you have a knee replacement surgery, the top part and the bottom part of the native joint have been cut out, and you have a metal knee here in place of it. I don't have one of them to show you, but the joint itself is not there anymore. So if you're having pain, the pain is not coming from the joint. The pain is almost certainly coming from the damaged nerves. And we already know from our anatomic studies and from our procedures that the nerves that supply sensation to the knee joint are in very predictable locations: here, 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 and here.
So there's very little guesswork.
Yeah, we know exactly where most of the sensation of the knee joint is coming from, and if we target with a needle, and I do this under X-ray, it's the ablation procedure that I talked about before. I do a nerve block first in those 4 locations in the office. It takes 5 minutes. If you get pain relief, it's very quick. You'll have pain relief within 15 minutes after we're done. It's a temporary pain relief, but it lets us know that your knee pain is likely going to respond to that nerve ablation that I mentioned earlier, and we do recommend nerve ablation as a way to treat chronic pain after knee replacement.
It can also, by the way, be used before we take this last call. It can also be used before a knee replacement to lower the amount of discomfort that you would have after the knee replacement.
That's very true. That's similar, maybe one step beyond the nerve block that a caller previously asked about. Commonly, local anesthetic numbing medicine is used to numb the nerves of the knee before knee replacement, but the ablation technique can also be used to reduce the pain after knee replacement surgery by doing the ablation maybe a week or 2 beforehand,
right,
so that the nerves are taken out of the picture before you go to surgery.